Okay. Can I start now?
Yes, please. Yes, please.
Okay. Okada-sensei, thank you very much for your introduction. So my name is Hideyuki Shiroshita. I'm from Kansai University, Japan. Actually, I graduated from DPRI, Kyoto University, when I was a master and PhD student. So I obtained my PhD degree from DPRI. And after that, I got my current post job at Kansai University. Kansai University established how do you say, Faculty of Safety Science in 2010. So it was nearly 14 years ago. So since then, I have been working at Kansai University. Today, because I graduated from DPRI, so I studied about disaster education mainly for natural hazards. But today I would like to share with a bit different topic, that is snake bite. So yeah, thank you very much for this, how to say, giving me this great opportunity to give this talk today. So let me share my screen.
Yes, please do so.
Yes. Yeah. So can you see my screen?
Yes.
All right. Thank you very much. So yes, at first I should apologize that I cannot jointly give my presentation with Nivedita Ray Bennett today. This is purely the result of miscommunication between myself and Nivedita. So we try to, how to say, adjust our schedule, but because of the miscommunication, she cannot join today's session. So yeah, at first I have to say sorry about this one. And then she is, the Nivedita is more knowledgeable about today's topics than me. So yes, I'm sorry for this. So yeah, as I mentioned, today's topic might be a bit unusual in DRR settings, but we ADN posit snake bite disease are also one of the important areas in DRR. Today's talk is not so organized as this is, the duplication of the presentation, which I have already done during IDRiM Company 23. So it was not so organized presentation either. So yeah, still my talk is not so organized. So yes, our intention is we want to share, what we are doing in India with you today. Right. So firstly, let me briefly introduce our network. So yes, as I mentioned, I am an associate professor at Kansai University, but also I am also one of the founding president of Avoidable Disease Network. So Avoidable Disease Network, we call it ADN, is a diverse, dynamic, inclusive, and innovative global membership network of expert practitioners and researchers interested in avoiding human disease from natural hazards, natural triggers, technological hazards, and human-made disasters, in particular low and middle-income countries. Of course, we have some projects in high-income countries like in Japan, but our main target is in low and middle-income countries. And our purpose is to help policy makers and practitioners make better decisions to save lives and reduce injury to achieve sustainable development. And I have not explained what avoidable disease so far. So avoidable disease are any type of premature disease. Previously, for example, in Nivedita's monograph, it was defined as disease beyond number 10. But nowadays, we don't use this definition. Instead, we use, we just say avoidable disease, any type of premature disease. So avoidable disease includes earthquake disease, tsunami disease, drowning disease, snake bite disease, and so forth. These are just examples. So any premature disease are avoidable disease, we think. And ADN is established by Nipedit and myself in March 2019. Okay. So today I would like to present our current project in India. So that is about avoidable snake bite disease. The project itself was started from this chart. So this chart shows the total number of diseases attributed to causes in the 20th century. Maybe some of you already seen this chart because this chart is from IFRC's World Disaster Report. So IFRC's World Disaster Report is very famous for people in the other field. So maybe some of you already seen this one. And actually, this is almost 10 years ago, 2014 one. And then you can see several big brown circles, such as non-communicable diseases, infectious diseases. These brown circles are the top categories of the disease attribution, and it includes natural words as a top category. You can find it at the bottom right corner. So natural hazards are included in this category. You can see here the natural world. Okay. Right. Okay. So this is an enlarged graphic of the bottom right corner. You can see several subcategories under the natural world. As I am a Japanese, earthquake is one of the main concerns of DRR. But if we compare earthquakes and snakes in numbers of deaths, snake causes 4 times more casualties than earthquake. So this fact drove us to start snake bite project in India. But I think some of you may not agree to regard snake bite as a disaster. However, there is an important fact of relationship between snake bite and flood. It has been transmitted that most snake bite diseases take place during the monsoon season by word of mouth. But this is not a myth, but a truth. So, for example, Carlos et al. Reviews preceding studies related to the relationship and concludes that the increase of snake bite incidents due to flooding has been repeatedly observed all over the world. So they added this phenomenon could be exacerbated because of climate change, which is expected to increase the overall magnitude and the frequency of flooding. So flood increase indirect disaster disease, that is snake bite. So as we have established a country chapter, ADN established a country chapter and research hub in India in collaboration with Orissa State Volunteers and Social Workers Association. So our main target country at the moment is in India. So in addition to this down-to-earth aspect, there is another reason why we should focus on India. So India is a country of snake bite, we can say. About 5.4 million snake bites occur each year, resulting in 1.8 to 2.7 million cases of envenoming in the world, and India accounts for approximately half of all global snake bite disease. A study estimates that India had 1.2 million snakebite disease from 2000 to 2019, with nearly half of the victims aged 30 to 69 and over a quarter being children under 15. So around 75 the victims under 670. And Our current focus is state of Odisha in India, not whole country. Our current focus is state of Odisha. So in India, snakebite disease are considered as an accidental disease. It has come under the category of other disasters. However, state of Odisha declared snakebite disease as a state-specific disaster. This was the first state in the country. And according to the government of Odisha's two latest annual reports of natural calamities, one is 2021 to 2022, and the other one is 2020 to 2021. So within 3 years, in total, 1,888 people died of snake bite across 13 districts in Odisha. And Ganjam district, this is one of the keywords of our project. So Ganjam district is bearing one of the highest number of snake bite deaths. So the Ganjam, we will have, the kind of the center, say the basement to promote our snake bite death project. Later, I will explain about the Ganjam district. So as you can see, snake bite and drowning are two major causes of disaster disease in Odisha. So we focus on drowning disease as well. Okay. So we ADN propose two different types of network to tackle with the avoidable disease. The first one is knowledge exchange network. Its acronym is KEN. So in short, KEN is the network for those who want to find yet unknown issues related to avoidable disease. So KEN is mainly for search or explore unknown issues related to avoidable disease. If we don't try to figure out this kind of unknown issues, this will lead us to unexpected events, and that usually create a huge number of avoidable disease. So KEN is also important. And another one is local level action network. We call it LAN, LAN. So LAN is for those who want to find solution to already known issues related to avoidable disease. Okay? So in order to substantially reduce the avoidable disease, we think both KEN and LAN are needed. So these are interconnected. As the initial step, we try to form the KEN for reducing avoidable snakebite disease in India. So the purpose of the network is to foster, number one, dialogue and discussion within and across 3 Indian states. Number two, coordination, cooperation, and communication among responders for resource sharing and response at local level. And number three, identify the scope for transformative research that combines social, medical, and space sciences. Number four, improve the capacity of local stakeholders. To identify, map, and assess the feasibility of context-specific key stakeholders, we developed 2 stakeholder mapping tools. One is mapping tools for national and state level stakeholders. The other one is for district, sub-district, and village level stakeholders. Then we identified 127 stakeholders in 3 states in total, and it can be classified into 3 categories. So the number one is at-risk local community responders. The number 2 is healthcare. Number 3 is venom and antivenom. The number 3 is public awareness. The number 5 is emergency services. And number 6 is snake profilers. So these 6 categories we have identified as stakeholders. And based on this initial research, we propose the Indian Community for Avoidable Snake Bite Disease. So this is a community as KEN Knowledge Exchange Network. This community connects the key actors engaged in and supporting Indians' efforts to reduce disease due to snake bite disease in India. it leverages the power of community to support the goal of the national program for prevention and control of snakebite and venom in India to reduce snakebite deaths by half by 2030, and the first two global targets of the Center from Work to reduce mortality due to disaster. And in addition to KEN, we have just started the project of a local action network that is KASA, we call. So CASA stands for Case Station for Avoidable Snake Bite Disease. So yeah, you know the term case station. Case station is one of the famous work in IDRiM society, I believe. So Okada Sensei loves using this case station type of word. So yeah, and then actually we learn a lot from Okada Sensei. That is why we use case station for our the station as well. So the first CASA was established on the 19th September 2023. So the day is International Snakebite Awareness Day. Actually, the 19th September is International Snakebite Awareness Day. So almost 3 months ago, we established CASA. And then the location is in Ganjam district. Ganjam is a keyword, as I said. So where the one with the highest number of snakebite diseases occurs. This is, the building of CASA. Actually, local district help us to use, this the place. Actually, it was health and wellness center owned by local district, local government, but now they allow us to use this health and wellness center for CASA. So now we are, repaint, refurbish, this building to use as a CASA. And also, this is, the map of India. And then, red pin shows the place, the location of Ganjam. Ganjam district is in Odisha, so west south of India. And then it faces, not directly face, but very close to the sea. So yeah, they usually, always affected. They are always affected by monsoon. So CASA exists to promote a social learning laboratory at the village level and to foster village level communities of practice to find solutions at large scale and to develop the capacity of primary and secondary responders to reduce avoidable snakebite disease. But we just, established it by the support of the local government. So we have to explore how we can run the CASA in a sustainable way. And then apart from the admin side, what we should do next. So during launch event, a member of Legislative Assembly mentioned that she would demand anti-venom serum at community health centers. But nowadays we don't think it is good. It is good idea to have anti-venom serum at community health center. So of course, if it's possible, it would be work, but we need some medical, the expert if we use anti-venom serum for the victims. So yeah, there are so many, the complex problem we have. So instead, currently, we are trying to establish, ambulance service, not well-established type of ambulance service, but we are trying to establish, the way to carry the victim to the nearest hospital in Ganjam district. But problem is the distance. So the district hospital, which can provide anti-venom serum to the victim, is very far from the CASA. the village. It's around 85 kilometers, and the road condition in India is not good. So it just means it takes 3 hours, 4 hours to go to hospital. But once someone is bitten by cobra or some venomous snake, strong one, usually within 1 hour, if they are not treated in a right way, they will they die. So I think distance is very normal the issue, but very huge issue for people in that community. So we just start to establish, we just establish, CASA, and then as the next step, we are trying to establish how can we, the system which we can carry the victim from the village to the hospital. So this is our next step. Yes. So I think this is the final. Right. Okay. Yeah, this is my presentation. So thank you very much for your kind attention. Thank you very much.